What are the ethical concerns of organ trafficking? Have you ever thought about the darker side of organ donation? Organ trafficking is a serious issue that raises many ethical concerns in healthcare today. Let's break down these concerns and understand their implications. First, organ trafficking violates the principle of respecting human dignity. Vulnerable individuals, often from impoverished backgrounds, are exploited. They may be coerced into selling their organs without fully understanding the consequences. This exploitation goes against the ethical obligation to protect individuals from harm and respect their worth. Next, we have the issue of informed consent and autonomy. Ethical medical practice requires that organ donation be voluntary and based on complete understanding. However, trafficked organs are often obtained through deception or force. This negates true consent and violates individual autonomy, which is a fundamental aspect of ethical health care. The principle of justice is also compromised by organ trafficking. It creates a system where wealthy individuals can buy organs, leaving those who rely on ethical donation systems at a disadvantage. This unfair distribution of resources exacerbates social inequalities and damages trust in healthcare systems. Another significant concern is the principle of nonmaleficence, which means avoiding harm. Organ trafficking often involves unsafe medical practices and inadequate care. This can lead to serious health risks for both donors and recipients, contradicting the very essence of medical ethics. Transparency and traceability are essential for ethical transplantation. However, trafficking networks operate in secrecy, evading regulatory oversight. This lack of accountability increases the risk of exploitation and medical complications, making it difficult to ensure patient safety. Healthcare professionals have a duty to combat organ trafficking. Physicians must refuse to participate in transplants involving illicit organs. They should evaluate donor-recipient relationships carefully for signs of trafficking and report suspicious activities to the appropriate authorities while respecting patient confidentiality. In practical terms, addressing these ethical concerns requires strong legal frameworks and international cooperation. Policies must prohibit the commercialization of organs and protect vulnerable populations. Ethical organ donation systems should emphasize altruism, voluntary consent, and equitable access, aligning with the core principles that guide medical practice and patient care today. Understanding these ethical concerns is vital for anyone involved in healthcare. By promoting ethical practices, we can work towards a system that respects human dignity and ensures fair access to life-saving treatments.